Dr. Nzinga Harrison is a board-certified physician specializing in psychiatry and addiction medicine. She challenges the common misconceptions surrounding addiction. She presents addiction as a chronic illness, deserving empathy, comprehensive care comparable to conditions like diabetes or asthma. In her latest book, Unaddiction, 6 mind-changing conversations that could save a life. Welcome to the program, Doctor.
Thank you so much.
So what inspired you to delve into the topic of addiction, and why do you believe changing the way people perceive it is essential?
Yeah, so I actually decided really young to be a doctor. And at that point, I thought I'd be a pediatrician because that was the only doctor that I knew. I had a fantastic surgeon in seventh grade, decided to be a surgeon. And so I went to medical school and did my psychiatry rotation and was just flabbergasted by how terrible people with addiction and other mental health conditions were treated, not just by the healthcare system, but also just in everyday life. And so professionally developed my passion. And now that I'm a psychiatrist, we look back in your childhood. And I have addiction and mental health conditions on both sides of my family, mother and father. And I think I was probably destined to be an addictions doctor and dedicate my life to changing the way that we treat people that have addiction.
Yeah, absolutely. Yeah, you talk about the childhood trauma. I'm amazed experience in therapy that how much what happens in your childhood affects you in your adult life in a lot of ways that you may not realize. And it's amazing as you discover that for yourself, some of those triggers that happen in your life, things like how you react to things, how you relate to people. It's amazing what's wrapped up in those formative years. In your perspective, why is it crucial to emphasize that addiction is treatable and chronic and not a choice or moral failure?
Yeah, so drug use is a choice. And in fact, almost 100%, not 100, but almost everybody chooses to use drugs, right? Look at the Starbucks line, look at the Dunkin' Donuts line, look at vaping and smoking. Addiction is an illness. And that means it has biological reasons it develops, it has psychological reasons. You touched on one like childhood trauma. It has environmental reasons, physically and culturally. And so if we don't understand it as an illness, we condemn people, which makes us stay silent, which means people don't ask for help, which means people die, which means medicine doesn't advance in learning about how to treat this illness. And so once we understand it as an illness, we can look at those biological, psychological, and environmental factors. We can make a plan. We can help people get better, and we can help people speak up because we're not judging them.
Absolutely. You're talking to me where I'm now here in Liberty, New York, where Sullivan County, where we have we have the highest overdose rates from opioids outside of New
Oh
York
my
City
gosh.
in New York State.
Wow.
And it's we have a crisis happening here. I'm always as a reporter, as also as a citizen, I'm just wondering how are officials approaching this? And they are
Mhm.
approaching from both ends, but it seems like more times than not is it's facing it with law enforcement.
Yeah.
We have here, I have to give credit to Southern County, we have here a thing called hope handcuffs. People who are in throes of addiction, when they are arrived by police, they have someone come there to the scene and help them get treatment and not and
Oh, I
hopefully.
love that.
Yeah, so that's a great program that we have here, but it's a really hard dilemma on how to deal with it with addiction when it has of there. But reason I said that is because if you're turning it to something that's treatable, no one's getting arrested because they're diabetic. No one's getting arrested because they're asthma. So
Say it again louder for the people in the back, right? Nobody's getting arrested because they have cancer. And so you can safely speak up about those conditions and get help. People with opioid use disorder, you're afraid your family might turn their back on you. You lose their job, you get arrested, you go to jail. Somebody posts about you on social media and your life is ruined, right? And so the more we can understand it as an illness, that develops our desire to want to help. You're not mean to sick people. You're not helpful and compassionate to people who are struggling with an illness. And so this is why it's critical.
yeah, absolutely. Dr. Harrison, how have your experiences in healthcare, particularly with patients overcoming addiction, influenced your advocacy for first people language and changing the narrative around addiction?
Yeah, so there's a statistic 46% of us know someone, have someone in our life who is living with or struggling with addiction. That's everybody, right? That's one and two. So that is everybody. And so when we use language that unintentionally drives stigma, like addicts, There's so much wrapped up in addicts. And one is that person is not the illness. That is a person with an illness. That is a person with addiction. And so I can hate addiction and not hate that person. Same thing like you're dirty. Your drug screen is dirty. Okay, so when I have active addiction, I'm dirty and I'm only clean if I'm in recovery. These are the type of language that we use that drive stigma, even when we don't mean to, that make it hard for one, people to get help, and two, for us to be talking about prevention.
Yeah, absolutely. Can you share a sort of a personal anecdote or experience that sort of shows your belief in the power of compassionate language and understanding when discussing addiction?
Totally. So I'll actually, this just happened. What is today? Thursday?
Thursday.
Thursday.
Yeah.
So this just happened on Tuesday. The book came out on Tuesday, and I was in the airport flying. I've co-founded this company called Eleanor Health. We take care of people with addiction in several states. And so I was doing a quick Instagram video like, oh, the book came out today. And a man in the airport came up to me and he's like, I noticed the name of the book that you're holding. And I'm like, yes, my book, it came out today. I was all proud. He had just flown into the airport to come help his brother get into treatment from addiction. And he said, I never go up to strangers, but like the cover of the book caught me. And so one, I said, I'm so sorry that your brother is struggling. Two, I'm so grateful that you're here to help him. Three, 75% of people recover from this illness. And I gave him a copy of the book and I gave him my phone number so he can text me to tell me how his brother is doing. That act of compassion, he's like, I bought a copy for my brother. I bought a copy for my wife's brother. I called my brother and told him I love him. Compassion is infectious. And when you're sick, compassion heals.
Right. And in your book, you have also real stories of,
Mhm.
right? And so how do you anticipate the real stories in your book resonating with readers and contributing to changing the perceptions?
Yeah, what I hope is that everybody will see themselves in this book. Everybody will see somebody they love in this book. So I tell my own personal stories in this book. I have over 20 years of professional experience. I'm telling the stories of people that I've taken care of. And really, the point is like from mild addiction to severe addiction, recovery is possible. The majority of people recover. So it's about hope and it's about being able to see yourself in a book about addiction that then decreases the stigma because it's not everybody else. It's not those people. It's me and it's my people. That makes us want to help.
Your book underscores the importance of having an open mind. We've been dealing with addiction for a very long time here in this country. So how can readers navigate the journey of questioning and reevaluating their existing beliefs and assumptions about addiction?
Yeah, it starts with reading this book. We literally have scripts in there, a conversation with yourself. How do you evaluate your own risk? How do you look at your biological risk, your psychological risk, your environmental risk in childhood and today? How do you have the conversation with your kids? There are scripts for toddler, elementary, middle, high school, adult. How do you have a conversation with a friend? How do you talk to your doctor about your risk, right? And so this book is in 6 sections. It teaches you what that risk is. It gives you real life examples. It gives you homework to apply to yourself. And it gives you a script to take that conversation to someone else. And I hope that's how it becomes viral.
Yeah. How do you recommend folks read your book when you first get it? All the way through the first time or pick sections out? Or how do you envision people reading the book?
I wrote it for both scenarios. So I wrote it for people who want to read straight through. It's like funny and hopeful and serious and education-y. But I also wrote it, you can look at a chapter and say, I'm struggling with this. And you can go to that chapter and you can read that chapter and immediately get something that will help you. In whatever way works for the reader, this book will give them helpful information.
And I say you mentioned before you incorporate exercises at the end of each chapter,
Yeah.
and which is a unique approach. When I've seen it done, and it re-emphasizes or uh, you get to retain the information more after you go through the chapters, test yourself in a way, or learn what you just learned. So, can you share sort of an example of one of the exercises and its intended impact might have on a reader?
Yeah. One is called The Cage. And this is a 4-item questionnaire that helps you evaluate your current use. And it's 4 questions. And if you answer yes to one question, at a minimum, you are at risk for developing addiction. you may already have a mild, moderate, or severe addiction. And so the C is, have you ever thought about cutting back? The A is, have you ever been annoyed when somebody else mentioned to you that they were worried? G, have you ever felt guilty because you said, I'm only going to drink one, and then you drank more than one? And E, eye opener, when you open your eyes in the morning, are you thinking about fill in the blank substance? And so one of the exercises in the book is do this cage on yourself for whatever substance. And if you have a score of 1, let's talk about how you have the conversation with yourself. And then let's give you guidance for how you ask for help.
Absolutely. For those who are interested in purchasing your book or looking for more information, where can they go?
It's everywhere. So online, Amazon, Barnes and Noble, indie bookstores, actually in stores as well. If it's not in your neighborhood store, please hit me on social at Nzinga MD. That's my first name, Nzinga, and then MD like medical doctor. The goal is for it to be in every store everywhere so that everyone's having these conversations.
Dr. Harrison, before we go, is there anything else I have not mentioned that you want folks to know about this book and your journey?
This book is for everyone. So this book is for you if you're struggling with addiction. This book is for you if you think maybe I'm worried. This book is for you if you have a loved one. This book is for you if you are a doctor or therapist or health professional. This book is for you.
Dr. Nzinga Harrison, her book is Unaddiction, 6 Mind-Changing Conversations That Could Save a Life. Thank you so much for joining us on the program, Dr. Harrison.
Thank you so much. Appreciate you.